Millions of people wake up, pour a cup of coffee, and take their medications in the same 5 minutes. Nearly 65% of US adults took at least one prescription medication in the past year, according to the CDC's National Health Interview Survey. So this isn't a niche question. This is a kitchen counter question. Here's the thing most people never get told. That cup of coffee isn't just sitting next to your pills. Sometimes it's arguing with them. It can make some medications work less. It can make others feel stronger than they should. And for lots of medications, it does nothing at all. The interesting part isn't which category your medication falls into. It's why. Because coffee doesn't have one move. It has 3 completely different ones, and they work through totally different pathways in your body. So let's break down the pharmacology. First, what is coffee actually doing in your body? Before we can talk about interactions, we need to talk about caffeine itself, because everything downstream depends on this one mechanism. After you drink coffee, caffeine gets absorbed through your stomach into your bloodstream. Hold that thought. The stomach is going to matter a lot later. From there, it travels to your brain, where it runs into a set of receptors that are normally reserved for a completely different molecule, adenosine. Think of adenosine as a key that's been building up in your pocket all day. Every hour you're awake, more of it accumulates, and every time it slots into its receptor, it sends one message: slow down, get sleepy. Caffeine looks similar enough to adenosine that it fits the same lock, but it doesn't turn the lock, it jams it. Pharmacists call this receptor antagonism. Caffeine blocks adenosine from binding, which blocks the slow down signal from ever arriving. The result is that instead of feeling drowsy, you feel alert. And it doesn't stop there. Blocking adenosine also triggers a release of dopamine and norepinephrine. These are receptors behind focus, energy, and a slightly faster heartbeat. That's the mechanism behind your 8 a.m. buzz. It's also, as we're about to see, the same mechanism that starts causing problems with certain medications. Coffee versus medication. 3 different fights. Here's where most explainers get it wrong. They treat coffee interacts with medication as one phenomenon caused by caffeine. It isn't. Sometimes it is caffeine acting on receptors, but other times it's compounds naturally found in coffee that have nothing to do with caffeine. And sometimes it's simply coffee changing the environment inside your stomach before the drug ever reaches your bloodstream. That's why pharmacists don't ask, does coffee interact with medications? We ask, how does coffee interact with this medication? Let's go through the 3 ways in order your body actually experiences them. Number 1. Coffee can block a medication before it's even absorbed. This is the interaction with the strongest evidence behind it, so it's the right place to start. Take levothyroxine, the medication used for an underactive thyroid. In a landmark 2008 study published in the journal Thyroid, endocrinologist Salvatore Benvega and colleagues documented 8 patients whose thyroid levels wouldn't stabilize, and they traced it back to one shared habit: taking their levothyroxine tablet with coffee or espresso. In vivo and in vitro testing confirmed it. Coffee was interfering with how much of the drug was actually making it to their bloodstream. But here's the twist that makes this genuinely interesting pharmacology and not just a scary headline. It's not fully settled how universal this effect is. A follow-up study by Vida and colleagues in 2013 found that a capsule formulation of levothyroxine wasn't affected by coffee the way the tablet was. And a 2022 industry-sponsored study represented at the Endocrine Society's annual meeting found a liquid oral solution of levothyroxine showed no absorption difference when taken shortly before coffee either. So, the interaction seems to depend heavily on the drug's formulation. Tablets appear far more vulnerable than capsules or liquids. Well, why would coffee do this at all? There are a few proposed mechanisms. It can reduce how well the tablet dissolves, or compounds in coffee may bind or adsorb some of the drug, or it can reduce how much of the drug reaches the small intestine where absorption actually happens. And levothyroxine isn't alone. Coffee is rich in polyphenols, the same plant compounds that get coffee and tea their reputation as antioxidant powerhouses. And these polyphenols can also bind iron, reducing how much of it your body can absorb. That's the real reason iron supplements are usually kept away from your morning coffee. On top of the binding effect, coffee can also change the stomach environment itself. It can increase gastric acid, stimulate contractions, and speed up gastric emptying. For medications like levothyroxine or alendronate, a medication used for low bone density, which need time sitting in the empty stomach to work properly, these faster transit times can mean less of the drug gets absorbed the way it's supposed to. So, 3 different tools coffee is using here. 1, binding, 2, dissolving, and 3, rushing the drug through. But all 3 land on the same outcome. Less medication gets where it needs to go. Number 2, coffee can pile its own stimulant effect on top of your medications. Now shift gears. This next mechanism has nothing to do with absorption. It's happening entirely at the level of what the drug and the caffeine are each independently doing to your nervous system. Think back to the mechanisms of action of caffeine binding to those adenosine receptors. Picture someone taking a medication that already stimulates the central nervous system, an ADHD medication, a decongestant, a certain asthma medication. That drug is already nudging the body toward more alertness and more sympathetic nervous system activity. Remember what caffeine does? Same neighborhood. By blocking adenosine receptors, it ramps up dopamine, norepinephrine, and even glutamate, driving alertness, heart rate, and blood pressure up on its own. So, when you stack the 2 together, you're not doubling the drug level in your blood per se, you're adding 2 separate signals that happen to point in the same direction. Pharmacists call this an additive pharmacodynamic interaction. 2 substances working through 2 different mechanisms, but landing on the same physiological outcome. The practical result is jitteriness, tremors, a racing heart, anxiety, or trouble sleeping, all more noticeable than either substance would cause alone. Number 3, coffee can turn up the volume on side effects you'd otherwise miss. This third category is the one that gets misunderstood the most, because the popular version of the story is usually stronger than the actual evidence. So let's fix that. Diuretics. Diuretics are often called water pills, and they help your body get rid of excess salt and water by increasing urine production. Caffeine does have a mild diuretic effect, increasing renal blood flow and temporarily reducing sodium reabsorption in the kidney, especially in people who are not regular coffee drinkers. Combine that with a diuretic medication like hydrochlorothiazide or furosemide, and someone might notice more frequent urination or more urgency layered on top of what the medication is already doing. But, and this is the part most content leaves out, regular coffee drinkers build a tolerance to caffeine's diuretic effects surprisingly fast. 2014 crossover study of 50 habitual coffee drinkers has found no meaningful difference in 24-hour urine output, even at daily intakes above 240 milligrams of caffeine. This is about 2.5 cups of brewed coffee. And that tolerance to the diuretic effect can be lost after as little as 4 days without caffeine. So for someone who drinks coffee every day, this interaction is mostly theoretical. It matters far more for someone who rarely drinks caffeine and suddenly has a large cup. Blood pressure medications. Same logic, different system. Caffeine can transiently increase sympathetic activity and norepinephrine release, which can nudge blood pressure and heart rate up, especially in people who are caffeine sensitive or don't drink irregularly. For someone on a beta blocker or managing hypertension, that can translate to palpitations or a weird feeling that seems to be undercutting their medication. But it would be inaccurate to say coffee cancels out blood pressure medication. What's actually happening is more precise. Coffee can temporarily nudge your cardiovascular system in the opposite direction of what the medication is trying to achieve, which is exactly why some people notice a difference right after their coffee, even though the medication itself hasn't stopped working. Okay, finally, the pharmacist thinking takeaway. When I evaluate a coffee interaction, I'm never just asking, did coffee change the drug level? I'm also asking, did coffee create the same effect as the medication, making a side effect more noticeable? Sometimes the interaction isn't about the medication changing at all. It's about the body receiving 2 similar signals at the same time. So the question is never, is coffee bad? It's, is it changing absorption? Is it adding another stimulant on top? Is it timing the actual issue? Or is there no meaningful interaction here at all? Coffee isn't the enemy. Understanding why it affects certain medications is what lets you use both safely. Even something as simple as spacing your levothyroxine and your coffee by 30 to 60 minutes can eliminate most of the absorption problem entirely. So what do you actually do with this? If you're a pharmacist or a prescriber, this is worth actively intervening on when the drug has a narrow window for error and absorption is the mechanism. Levothyroxine and oral iron are the clearest cases. Counsel patients to separate those from coffee by at least 30 to 60 minutes. And if timing isn't realistic for them, consider a capsule or liquid formulation, which the evidence suggests is far less affected. For the additive stimulant and diuretic or blood pressure interactions, the intervention is usually education, not a dose change. If a patient reports new palpitations, anxiety, or blood pressure creep after starting a stimulant or titrating a diuretic, ask about caffeine intake before assuming the medication itself is the problem. Now, if you're the one taking the medication, the fix is almost always timing, not quitting coffee. Keep at least 30 to 60 minutes between your coffee and your thyroid medication, iron supplement, or alendronate. If you're on a stimulant medication or a blood pressure medication and you notice jitteriness or a racing heart, try scaling back your coffee for a few days before assuming something's wrong with your prescription. And bring it up with your pharmacist rather than adjusting the medication yourself. If this kind of pharmacology breakdown is useful for you, I put together a couple of free downloads. One is a 50 high-yield pharmacology facts that every student should know, and the other is a medication decoder guide, so no medication feels like a mystery. Link is in the description, so go ahead and grab it. And coffee isn't the only everyday thing quietly changing how your medications work. Grapefruit, smoking, and even your gut bacteria can do the exact same thing, through mechanisms just as different from each other as the three we just covered. That's up next.